Everyone. My name is Carolina Mejia, and I am the Commissioner for District 1. Thank you all for joining us today. I am very excited to see all of you here. All of you are distinct leaders for your organizations, and I know you've been receiving many questions in regards to what we are doing in terms of vaccination. So with that, I hope we get to answer many of your questions today. For those of you who couldn't join us, you can always watch this via YouTube. We are doing it live, and that's on the Thurston County YouTube page. I will go ahead and introduce staff with us here today. Is Public Health and our Public Health Officer, Shelley Slaughter. We also have Dr. Abdimalik and our County Manager, Ramiro Chavez. And with that, I'll pass it on to Ramiro.
Good afternoon, and thank you for joining us, Ramiro Chavez, County Manager. Let me just walk you through what are you going to be expecting this afternoon. And first of all, I'm going to give you what I call the rules of engagement of this meeting. Then we'll move on to give you a little bit of an overview of vaccine. Dr. Abdimalik has a short PowerPoint presentation. And then we'll go ahead and answer the questions that we receive ahead of time. And I will ask you to please mute yourselves. This is not going to be an opportunity to have an open dialogue because we need to manage the questions we have received. Based on the responses that you will hear, if you have follow-up questions and if we have time, please type it in the chat. And Katie is going to help me to get through those questions as we move along. Later on, we'll touch base on some opportunities for volunteers. I think that was probably one of the questions we have received. And at the end, I'll provide some closing comments. And hopefully we can be done here in the next 50 minutes or so. With that in mind, I would just give at this point the floor to Dr. Abdimalik, a Public Health Officer. And I think she has a PowerPoint. They will give you high-level information as to how the vaccines are distributed to Thurston County. Doctor?
Thank you. Hi, everyone. I'm Dr. Damiana Thulmalik. I'm the Thurston County Health Officer. I did want to just begin by giving all of you an overview of our vaccination efforts and the state of the vaccination process here in Thurston County. So we have some exciting news. So in addition to the 2 vaccines that we've been able to dispense in our county since the end of December, Pfizer and Moderna, which are mRNA vaccines and 2-dose vaccines, the FDA approved the Johnson & Johnson vaccine. So they looked at the data on Friday. The CDC's Advisory Committee on Immunization Practices reviewed it initially yesterday and has chosen to recommend the vaccine. Today is a second day of meetings with that same committee at the CDC to see where this 1-dose vaccine fits into the overall goal that we, along with our state and federal colleagues, have of vaccinating as many folks as would like vaccine in our counties, and then of course at the state and national levels. So we're still waiting for some of that information and guidance to come to us both from our federal colleagues as well as our State Department of Health colleagues. So it is extremely hopeful that we have a new tool that will help us bring about the end of the pandemic. But we're still in that in the stage of getting more information about who would be best served by this new vaccine. I did want to state that while it's a little bit different from the 2 vaccines that we've been dispensing throughout the county, it it is on par with the existing vaccines in terms of preventing hospitalizations and deaths from COVID-19 with the other two vaccines that we have available. And I'm excited to look at the subgroup analysis to look at the efficacy data in terms of symptomatic disease, which is where initial data looked a little different. So that situation is extremely dynamic, but I'm extremely hopeful and excited to have another tool to help us get folks vaccinated. So when people are asking us a lot of the time, when is it going to be our turn to get vaccine? So here in Washington State, we have, so at a federal level, there's an allocation framework that was put together by the National Academy of Sciences and Medicine. And that was way back in late summer, early fall. Then the CDC looked at it and broke it out into specific phases. And then the Washington State Department of Health, looking at vaccine supply and looking at the Washington State specific context, has devised tiers and phases for Washington State, with the goal being to get everyone vaccinated who wants vaccine in an equitable fashion. But because of the limited supply of vaccine, we've learned that having smaller, more manageable groups being eligible at a given time is actually more efficient and effective than just issuing a green light and having everyone rush. So a lot of that tiered approach that we're seeing now through phase 1B is an effort to get everyone vaccinated in an orderly fashion, taking into account the risks that people have, both of getting the disease, so healthcare workers, people working in long-term care, our critical infrastructure workers, as well as folks that are really at high risk of having significant complications. So folks with increased age, folks with multiple comorbidities, as well being the primary guideposts here in phase 1A and 1B as we move on, as well as folks who are in congregate settings, so folks that spend a lot of time in close contact with other folks. So this is an overall, this is the overarching approach that Washington State Department of Health has taken, with, of course, some local input but we're in alignment with this framework, and each vaccine provider signs on to only dispense vaccine in alignment with this framework. So right now we are in phase 1B tier 1. So that includes everyone in phase 1A, which was the first phase, which is healthcare workers, medical first responders, and folks that live and work in long-term care facilities. And now we're in phase 1B tier 1, so anyone over the age of 65 and anyone over the age of 50 in a multi-generational household. So 3 generations, so an elder and somebody, caring for them, or grandparents raising grandchildren, being the most common definition for that. Looking ahead into future phases, we're looking at high-risk critical infrastructure workers, initially broken out into tier 2 and tier 4. However, when we were thinking about, and by we, I mean at the state level, thinking about how to best vaccinate folks in the most expeditious manner that supply allows, we are able in some cases to combine tier 1 and tier 4. So those initially were critical infrastructure workers separated by age greater than 50 in tier 2, age younger than 50 in tier 4. But we're able to combine for ease of vaccination and getting everyone vaccinated as expediently as possible. Tier 3 really is folks that have 2 or more comorbidities, listed by the CDC as putting them at high risk for severe outcomes from COVID-19. And those are folks in the 16 to 64 age group. So we still have a little bit of time to go before we can transition into tier 2. So we still have a lot more work in tier 1 that's ongoing. So where are we now? So as of today, 11.83% of Thurston County residents have received 1 dose of a COVID vaccine, and 5.21% of Thurston County residents have completed a series, so have had both doses. This actually breaks out into 33,820 folks that have had at least 1 dose, and 14,890 folks that have had both doses of vaccine. Here in Thurston County, we have been really fortunate to have incredible partners in our community with our fellow providers, with EMS, with Department of Health, with South Sound Senior Services, and a number of other folks who we've been able to work with in terms of helping folks get vaccinated. We have also expanded our capacity to dispense vaccines. So this week is our first week dispensing the Pfizer vaccine. And a lot of this is as we expand our capacity to dispense all 3 of the vaccines that are currently available, that makes us eligible to get that. So that really helps us and our state partners to ensure that we here in Thurston County get as much vaccine as can be fairly allocated in the context of the state. So that's really exciting for us, is being able to dispense all 3 of the currently available vaccines. And with that, I would like to say thank you so much, all of you, for coming, and thank you for submitting your questions in advance. And I'm really looking forward to the rest of this Q&A.
Thank you, Dr. Abdelmalek. Appreciate the time. And we will send a follow-up email after this session is completed, including the PowerPoint and additional information for you to follow. As Dr. Abdelmalek stated, I also like to thank you for those who submitted questions ahead of time. Some of the questions that we've received perhaps answer the same thing, so hopefully we can go through that and give you an answer to that. Also, and again, if depending on the responses that you hear today on those questions, pre-submitted questions, please send those in the chat, and we'll make an effort to follow up on those and any clarifying questions. With that in mind, then Shelley would like to take the lead on those questions, or Dr. Abdelmalek?
Thank you so much, Ramiro. I believe the first question Dr. Abdelmalek is going to answer, and that one is from the Child Care Action Council.
The question was, why aren't child care workers considered as much of a priority for vaccinations as K-12 teachers when they're being considered as essential workers in education at the same designation as K-12 teachers? So I did want to say that we, of course, definitely value all of the work of our child care providers in our community. It's been essential to all of our essential services, and all of our core society functioning has really, we've definitely appreciated the work put in by our child care workers. They are in Tier 2. So Phase 1B Tier 2, which is our critical infrastructure workers, which does include both child care workers and K-12 teachers, grocery store workers, folks that are working in agriculture. So folks that are true, folks including definitely our child care workers that are truly critical to our society. and are also at increased risk by the nature of their jobs of getting COVID-19. So in terms of the allocation priorities by the Washington State Department of Health, which we're in alignment with, both teachers and childcare workers are both in that tier 2 phase.
Next question. So the next question I'm going to answer, and I do want to just say that it is so lovely to see all of you, and thank you so much for being here today. It's so nice to see so many friends and partners on the call today. And again, my name is Shelley Slaughter, and I'm Director of Thurston County Public Health and Social Services. And the next question is, how do people of Thurston County in their 80s get the COVID vaccine, especially if they're not savvy with technology? And that is a really excellent question and something that's of great concern to us. Not everyone has access to internet or computers or is able to navigate technology or have a smartphone. And so for that reason, we have at Thurston County Public Health and Social Services committed that 20% of our appointments for our clinics at least are offered to those that need special assistance in making appointments and those who do not have access to technology. So seniors who are in this situation or anyone else that are in this situation can call Thurston County Public Health and Social Services at 360-867-2610. And we have a team of people during the hours of 8 to 5 to help people in navigating, getting an appointment, and getting them on a list if they need special assistance in accessing vaccine as soon as we have it available. The other option for people is to call Washington State Department of Health's COVID vaccine hotline. And this is answered 7 days a week. I believe they just expanded the hours from 9 a.m. to 7 p.m. and that is subject to change. And that number is 1-800-525-0127. And it is available in multiple languages. And the staff answering that hotline can help people to make appointments and register them. And then the next question, I'll just keep going, is from Senior Services of South Sound. Brian, thank you so much for being here, and thank you so much for your partnership. It's been wonderful. We were able to have a successful first dose vaccine clinic at the Lacey Senior Center last month, and we're about to have the second dose clinic coming here this weekend. So the questions are, as the state continues to receive vaccine and they get distributed into regions, we're concerned that the push for mass vaccinations will not give Thurston County enough doses to have clinics at Senior Services for South Sound where we're specializing on vulnerable seniors. Any reassurances on that front? And I will say, yes, we share that concern when the governor announced the launch of multiple state-operated mass vaccination sites, and we ourselves here in Thurston County are planning to launch our own mass vaccination sites coming here, and I'll share details about that in a moment. We get really concerned about that too, because mass vaccinations can be great because they're open to many people, they're open to everyone, and so that can really help to reach people. But at the same time, it doesn't reach everyone. It's not accessible to everyone, and we want to make sure that we have vaccines available. And that's why we have reserved a minimum of 20% for special populations of any vaccine allocation that Thurston County Public Health and Social Services receives. And we are one of the vaccine providers in Thurston County that has vaccine. So that is our commitment. We want to make sure that there is vaccine that is available in multiple ways for people to access. The next question there is, we stand ready with many skilled and vetted volunteers to help at our vaccine clinics in Lacey and Olympia, but are waiting on the county green light for some way to put them to use. Any progress on that front? And yes, there is progress on that front. we have had several weeks in Thurston County where all of the providers have had very limited first doses, either none to little first doses of vaccine. We are finally starting to see some vaccine flow. Dr. Abdelmalek mentioned that we are now capable of administering Pfizer vaccinations, and good news about Johnson & Johnson. So we're really hopeful that more vaccine will be coming to Washington State and thus to Thurston County very soon. And we are going to need many volunteers to help us. And we will be having additional clinics at Senior Services as soon as we have some additional supply confirmed. And I'm also very happy to see Chris Wells, Executive Director of Thurston County United Way, on this call. We have been working with United Way to help engage volunteers in our community. There are many, many people in our community who are really interested in ways that they can help, and we'll talk a little bit more at the end of this session on that. But lots of opportunities with both our Thurston County Medical Reserve Corps for medical volunteers and other volunteers in our community to engage with United Way to help support our upcoming clinics. And then the next question is there an effort by the county to get Washington Department of Health PrepMod, which is the system that we utilize to schedule appointments in Washington State, updated to offer more language options? And we're concerned about language barriers, and we are too. So I will say that the Washington State Department of Health Vaccine Finder and Find Your Phase, which is where we encourage anyone listening who's interested in finding vaccine available in Washington State or in Thurston County to go to. And that has been recently updated to be available in 13 languages and counting. So that's really excellent news. And we hope that the PrepMod tool, which we use, will soon be also modified in multiple languages. We have made that request ourselves. I know that they are working on that, and those systems are integrated together. So we hope to see that soon. In the meantime, if anyone has any language barriers, we have people on standby that can help to navigate in multiple languages. And we are committed to partnering with all of you in helping to reach underserved populations and reach those that may not have English as a first language, and helping them to access vaccine, even if we may not have their native language speaker available on our staff or volunteers. So we have other tools that we can utilize, but we'd love more help in that regard, because that's really important to us. And then finally, are we safe in assuming that the county will continue to host clinics for seniors until every willing senior has been vaccinated? And absolutely yes. Dr. A mentioned the phases and the tiers that we are in now. Even when the governor decides to move Washington State to the next vaccine phase level, which we anticipate might be in the next couple of weeks to a month. We're not really sure. It's going to depend upon federal supply of vaccine to Washington State and the percentage of people that have been vaccinated statewide in the current phases before the next phase will open. But once that happens, I want to reassure everyone that we will continue to be prioritizing everyone that is in phase 1A that still has not been vaccinated, everyone in phase 1B, tier 1 that has not been vaccinated. No one in Thurston County will be left behind. We will continue to prioritize them for vaccinations. And then the next question is to Dr. Abdelmalek, and that comes from Family Education and Support Services. Great to see you, Shirley.
So the question is I would like to know more about what efforts might be taken to help those who are high risk and underserved. For example, we are aware of seniors living in a senior living facility next door to St. Peter's, and this population has significant technology barriers. Many don't even have internet. Who will reach out and aid them in accessing vaccine? If we are aware of the plan, we would be better able to communicate with them. So thank you. That's a really good that's a really good question and comment and offer of support. So we've talked a bit about our 2610 line, so 360-867-2610, which is a phone line that folks who are having difficulty with the internet and are more comfortable with phone-based scheduling can call. And we have been scheduling clinics using that list here at Thurston County Public Health, which is also coincidentally fairly close to St. Peter's Hospital as well. In addition, as more vaccine becomes available, in addition to our mass vaccination sites, we're intending to have mobile clinic units. So we've partnered with DOH and both as the county health department and DOH as our partners have set up clinics for independent living facilities. We've also gone out in partnership with DOH, Medic One, and our own staff to go to adult family homes because they're phase 1A, and just making sure, as well as collaborating with our pharmacy colleagues and partners to make sure that nobody's left behind in each phase. So moving forward, we are excited to continue to kind of work to make sure that we serve everybody in phase so that everyone who wants vaccine can get it. Feel free, if you have a specific population or group that you're concerned about, feel free to shoot us an email. And we can, and we'll work with our providers and our network to see how to best serve everybody. So thank you so much for that, for all of that.
And then the next question is back to me. And that one is, are there efforts to reach underserved high-risk populations? For example, we recognize that nonprofits such as Cielo serve as trusted messengers in serving vulnerable non-English speaking populations. Is there a plan to communicate, partner, collaborate with nonprofit providers to reach these populations? And then your agency, Shelley, thank you, serves 600 multi-generational families and would like to partner, and that's wonderful, and we would love that. So the first part of that question is, are there efforts to reach underserved high-risk populations? And yes, absolutely. Our mission at Thurston County Public Health and Social Services is working together to achieve the highest level of health and well-being for everyone in our community. And a critical role that we play in our vaccination efforts in Thurston County is to make sure that we are achieving health equity and that we're prioritizing underserved populations and that we're filling gaps that traditional healthcare providers can't. So that is our commitment and our goal in terms of the efforts that we have in our community, but we need partnerships to do that. We need those trusted relationships that all of you have built with the people that you serve to partner with us to help to reach them. And we have been engaged in conversations with Cielo and Julio and Diana. I'm very happy to see you here on this call today, working on developing a relationship to increase our efforts to reach our Spanish-speaking population here in Thurston County, as well as many other populations. So we would love to develop further partnerships with all of you, especially in your service to those that are traditionally underserved, our BIPOC community, those experiencing other types of access issues, those that are disabled, and other non-English speaking populations that we may not already have a relationship with and be able to reach. So we would love to do that further. And then in terms of serving multi-generational families, absolutely, they are in phase right now. So we want to make sure that we have a plan to make sure everyone that is in that situation is available. And I know, Shelley, you and I have touched base about some partnership opportunities to reach low-income families, and I would love to talk further about how we might help to connect kinship families with vaccine. We've been on this dry spell of not having vaccine for many weeks, so finally we have something to be able to offer and work on. So we're really happy to be here at this point and able to do more. And then I'm going to keep on going with the questions because we do want to make sure that there's time for others in the chat box, and I see some of those are coming in. So the next question from Mindy at Community Foundation. Lovely to see you, Mindy. And this is a quote here. I've been seeing the reports at the state and federal level about the vaccination rates lagging for people of color. Does the county know if that is true here? What can or is being done to ensure our most vulnerable have the opportunity to get the vaccine? And yes, so this Washington State Department of Health released a report last week on race and ethnicity data for those that have received the vaccine. And indeed, and not surprisingly, and unfortunately, it really shows some disparities in access to our community. In terms of Thurston County specific data, we don't have the specific Thurston County race and ethnicity data available to us yet. We've requested that from Washington State Department of Health that holds that data for county level specifics for all providers. But what we do know is what Thurston County Public Health has done thus far. And I will say, just want to share a couple things about what we do know in terms of those gaps here. So we have approximately, let me make sure I have my data correct here, approximately 12% of our community that is part of the BIPOC community, so Black, Indigenous, people of color. And our vaccination data for Thurston County Public Health thus far, and we have administered a total, Dr. A, do you have the total of vaccinations for Thurston County Public Health thus far? I just want to make sure I get that right before I share the percentages.
Give me just a moment.
In any case, while Dr. A is looking up our Thurston County Public Health specific data, I'll tell you, we have about 290,000 residents in Thurston County. About 12% approximately are estimated to be BIPOC, about 7% non-English speaking, and about 17% of our residents identify as disabled, which is a pretty big population. So that's also something that we are keeping in mind. And then in terms of, I'll share with you some of the percentages that we know about while Dr. A looks for that total so we can put the percentages into context. But right now, our vaccination data looks like we have vaccinated about 10% BIPOC, while we estimate about 12% of our total community. So we do have a gap there in this first phase already. So we want to make sure that going forward that we are closing that gap and that we are making sure that our efforts are reaching BIPOC people, people with disabilities, people with access issues, our houseless community, and others that that may have unfair disadvantages into accessing a life-saving vaccine. So that's a huge concern to us. It's something that we are proactively addressing, as is Washington State Department of Health, to make sure that we're working together to do that. In terms of our Native American population, so we are surrounded by our wonderful tribal nations, and they have a separate vaccination process and supply and rules that apply to them. And we have been in contact with our tribal communities, and our Medical Reserve Corps has been deployed to support our tribal communities in their vaccination efforts. And we're largely hearing that our Native American families, individuals, and elders are having opportunities to access vaccine right now. Where we show the greatest gaps in our data is in terms of reaching the Spanish-speaking and Hispanic population in our community. That's where the greatest gap is. That's where we have the most work to do. And one of the reasons we're really excited to partner with Cielo and others to help to close that gap. I'll pause there and see if Dr. A has more information to share on that.
Yeah, so at this point, we have given 2,432 first doses and 654 second doses for a total of 3,086 total doses. We do partner with folks in some of our clinics, so this just counts the doses used in those clinics that were allocated to us at Thurston County Public Health.
Thank you so much for sharing that number and clarifying to put those percentages into context. So again, we're looking for county-wide data to be able to share with the public, and we'll be doing so as soon as we have it. Right now, we're able to look at what we have been able to do thus far, and that's the data that we have. I do want to share also that in terms of impact of COVID, deaths, hospitalizations, and infections, that one community that we see has the greatest disparities is our Native Hawaiian, Asian Pacific Islander community. So we are really interested in developing partnerships with that community as well to make sure that we're addressing those gaps. And as a parent of Native Hawaiian children, that's really important to me. So to the next question here. This one is for Dr. A, and I'll go ahead and read it for you, Dr. A, and then you can just answer. How's the county working with nonprofits that work with the most vulnerable populations such as unhoused people, homebound seniors, people whose primary language isn't English?
So we've definitely started making inroads into helping out all of these groups. So we have been meeting with shelter providers. We did have a vaccination event at the Salvation Army, and the second dose vaccination for that group is actually upcoming within the next week. We have been working with Department of Health and EMS on our adult family homes, and we're planning outreach efforts both as a county and with our Medical Reserve Corps, as well as Department of Health, to provide vaccine to homebound seniors. In terms of folks whose primary language is in English, we have been talking to community leaders in our Vietnamese speaking community, as well as others, because while Spanish and Vietnamese are the primary languages other than English most frequently spoken here in Thurston County, we do have folks that have a number of first languages, and so identifying those communities and working with their community leaders is something that we've started. A lot of our efforts. So while we do have some relationships in place, a lot of these efforts have really been awaiting vaccine. So now that this definitely leads me to the next part of this question, which is, I know that you've had less access to less vaccine than we were expecting. How is that going, and when do I expect it to improve? So the good news is I do think that we are on the upswing. We are definitely still in the limited vaccine phase of the pandemic, but we are seeing increased vaccine allocation to Washington State from the Department of Health of the two vaccines that we've been dispensing, so the Pfizer and the Moderna, and then with the addition of the Janssen or Johnson & Johnson vaccine, we are expecting to see that supply increase. I did want to just take a moment and just mention that part of the reason why we were having difficulties with first dose allocation for the last few weeks was because in the beginning, a lot of folks, the governor issued a call for everyone who had vaccine to use what they had within 7 days of receiving it. And so the providers in our community put together large-scale clinics and got many members of our community vaccinated. And many communities throughout the state did the same thing. And so what we were seeing in the last several weeks, what was the second doses for those clinics came up. And so, of course, anytime someone gets a first dose, we are committed to their second dose. Us and the State Department of Health are committed to getting them that second dose. And so that took priority. And then with the weather impacting shipping when we had our snow weekend and the country also was experiencing winter weather, kind of delayed some of those clinics as well. We are seeing the light at the end of the tunnel, and we're excited to be having an increase in our first doses coming up. So good news on the horizon. We're not quite to unlimited vaccine supply, but we're making inroads in increasing that supply.
Thank you, Dr. A. And then the last submitted question was, what do you need from the community and from the people on this call? And that's one of the reasons why we are so happy that all of you are here today. We need your partnership. We need your support. We need to get messaging out to our community. And you are the ones that have those trusted relationships with those that you serve. So we're really grateful that you are here. I mentioned earlier that United Way of Thurston County will be helping to recruit and manage volunteers for our upcoming vaccination sites and clinics. We do have mass vaccination sites planned at Thurston County Fairgrounds, South Puget Sound Community College, and some also continuing at the Lacey Recreation and Athletics Center. We are also planning for mobile clinics, on-site clinics with partner organizations, such as many of you on this call, as well as mobile and pop-up clinics, reaching out to individuals in the community throughout Thurston County, regardless of where you live, so we make sure that we have opportunities for people to get vaccine. And we also have a need for translators and interpreters in multiple languages. So if any of you have people on your staff that are interested in helping to support our efforts in that way, we would really very much appreciate it. And I know we are running very close to the end of our time, but people on this call have questions, and I'll pass it to Ramiro for that part.
Yeah, thank you, Shalay, and thank you, Dr. Abdelmalek. Let's spend the next 4 minutes to go through the questions we have received. We may not be able to get them all, but certainly we can go through that process. I have one. This is, does Thurston County Public Health Social Services have vaccines? I believe that question was answered by Dr. Abdelmalek. We do have an allocation, and we'll continue to see that, as Dr. Abdelmalek stated, increasing in the future. The next question, and I think it's more of a statement, we have 15 volunteers fielding hundreds of calls a week from seniors seeking help with appointments and lacking internet. And again, I believe that question has already been answered. We'll make an attempt to reach out to those who doesn't have either the ability or perhaps the technical knowledge to get on the internet. Next question. It is a statement from United Way. Anyone interested in volunteering at one of the mass vaccination sites in Thurston County, please go to unitedwaythurstoncounty.org, and we'll provide that information on a follow-up email they're going to be sending to the group. The next question, so we have asked by Thurston County Public Health and Social Services to compile the list of BIPOC elders. The list has been growing. we have not received any follow-up from public health leadership, even after reaching out to follow up. We'll make sure we follow up to that question as soon as this meeting is completed. Next question. This is a great idea. Information sharing has been a real challenge so far. We have thousands of seniors relying on us. Can this be a format that can be reoccurring? Certainly, we'll make sure if this is a successful and welcome setting to share information, for sure we'll organize future meetings for a Q&A as we move along. Next, we would love to post helpful information or infographic in our Facebook page, and that can apply to all of you, I believe. Could you really release something to attendees and let us know what we can post? Yeah, what we will do is we'll send a follow-up email, and we'll include a link to the Public Health COVID-19 webpage, so we'll make sure that is the case. And I believe that's all the questions that we have. So in the last few minutes, it was a lot of discussion related to the volunteers. As United Way stated, we'll send an email and the follow-up email as to how volunteers, they can sign up through the United Way. We're in the process of partnering with United Way, and we need to get into a contract. Hopefully that contract will materialize soon. For those volunteers who have medical background, there's also a need for that type of volunteers, and they can sign up with AmeriCorps. And we will include that link also on the follow-up email, as well as any additional information related to the website that you can help us spread the news. This particular session is being recorded, and we'll include the YouTube channel as to when they can revisit it and go back and see any other individuals who may benefit from the responses that we have provided today. Next, Shelley discussed the mass vaccination sites that we're planning to do, and this is the type of infrastructure the county needs to build when the mass vaccination becomes available. But rest assured that nobody will be left behind. For those individuals who are in the early phases, we will make an attempt to everyone who is willing and able to get a vaccine will do so. And that is our commitment, so that nobody is going to be left behind for those individuals who are qualified and also are willing to take the vaccine. Our goal as a Thurston County is to vaccinate every single citizen in Thurston County that wanted to have a vaccine. And that is our commitment in the long term as we move along. I know there is going to be a lot of need for small and individual clinics, and the resources are limited, and we'll make just about every single effort to host those meetings. The mobile units will be available, and we'll reach out to each one of you for those the gaps that we have identified today. Some of you is going to be able to help us overcome those gaps by having those small clinics. And again, we'll reach out to you because we really value your partnership. That's all I have for you today. I'm going to leave some room for Commissioner Mejia if you'd like to provide some closing comments.
No, just to, again, say thank you for showing up. And just with some comments, yes, please pass this information to your staff. Please pass this information along to the people that you provide services for. This is for them as much as it is for you. And we couldn't do this without your support, without your help. And I really look forward to partnering with more of you in the future. So thank you again for showing up. And with that, we are adjourned.
Yep, thank you. So be at the lookout for the follow-up email with additional information. Thank you so much for participating on this Q&A. And certainly we'll host another one as the time allows. Thank you.
Thank you so much, everyone.
Thank you.